Isaac Zablocki. I'm the Director of Film and Literary Programs here at the JCC. Tonight's film will be followed by a special discussion with the filmmakers. Next week, we added on a special event for those of you who have not heard yet. This is not a screening of the film Jellyfish, so there's no confusion. This is an event with director and writer Shira Geffen and her husband, co-director and co-writer Edgar-Carrot. They will be talking about the making of Jellyfish. We'll be talking about Shira Geffen's career, a little bit about Edgar-Carrot's career. He's been here before, so we don't have to focus on him as much. And then we'll be showing some of her short films and talking about the actual film Jellyfish, which won one of the major awards this year at Cannes and is opening in the city April 4th. The week after that, actually, we were forced to switch the film. Luckily, things worked out that the film 2 weeks from now is being switched with something wonderful. We had to switch the film My Mexican Shiva with a special preview screening of Constantine's Sword. Mexican Shiva changed their opening date, and they'll be opening this summer instead, so we hope to have it back then. Constantine's Sword is a documentary based on the book, which will be opening at the end of April. So this is April 7th. Will be Constantine's Sword. That was added on. And finally, one more add-on we have is Then She Found Me, which is the new Helen Hunt film starring Bette Midler. Helen Hunt directed and stars in it. Colin Firth is in it too, for those who are fans. And we'll be having an event here with the writer and a special preview screening. Tonight's film, which I think the title says it all, Cuts Slicing Through the Myths of Circumcision. I think you all know what you're getting into. I don't have to warn anyone. There will be circumcisions in this film, but none after. The film definitely raises a lot of questions, and I'm sure there'll be a really interesting conversation afterwards. So please stay for the conversation, and I look forward to seeing you then. Please silence your cell phones and enjoy.
Thank you, Isaac. Thanks, everyone, for coming out tonight. I really appreciate it. Do we have any questions?
I'll start it off just with a quick question. Sure. How's this film been received so far? It seems it could be considered by some, and I'm sure some from all sides consider it controversial because you really get into some difficult topics here in the Jewish world, at least, and possibly beyond. How's it received?
Yeah, so we've been very lucky so far, I think. So far, for the most part, people who have seen it seem to have responded really well to the film. I have received some hate mail, but that was from people who hadn't seen the film, so exclusively by people who hadn't seen the film. So far, so good. Yes, sir.
Does that figure include the Muslim boys who are circumcised?
So that's a good question, actually. And the language at the end, I understand, can be a little bit confusing with regard to Muslims. I sort of specified routine infant circumcision. Muslims typically circumcise their boys as children as opposed to infants. And I know it's a bit of a distinction, but it's an important one. And it also, I mean, it was important to me to sort of draw out this interesting and bizarre sort of connection between, you know, the Jewish world and the American world. Yes, sir.
Firstly, I thought that was your dad, who I thought was the real star of that movie, and I really liked him a lot. Oh. And obviously, I illusion. But I have another data point that might surprise everybody that's an expert on this. Just a couple of weeks ago, I met an engineer. I'm an engineer, and we're very practical guys, you know. And he worked in Saudi Arabia for many years in the desert. And he said to me, "Boy, do I wish I was circumcised." And I looked at him because he's not Jewish. And I said, "How could you possibly say a thing like this?" And his answer was that, and it's the same thing that the doctor said, if you can keep it clean, fine. In the desert, you can't keep it clean. And maybe that's why the Muslim or the Arabs do it. But that's another data point for your next version, I think.
Yeah, so it's interesting. I mean, you know, I've heard that before, of course, and I think nowadays that's not really true anymore. I mean, I think for the most part, people who live in desert countries are able to keep clean, and my understanding, in any event, about that point is that for some time now, that's not been a problem. Yeah, no, and I know people think that, and I know that's one of the sorts of things that come up a lot is the sort of hygiene issue or the cleanliness issue, but I'm not so persuaded by it. Yes, sir.
I have a question. Obviously, from our own experiences, we know that a baby of that age feels a lot of pain. Do you have any experience or knowledge in knowing, let's say, a 9, 10, 12-year-old boy where a family or the child elects to do it? What kind of pain do they feel in the modern circumstances?
Right, so the question is whether there's a difference in the pain between doing it on an infant and doing it on a 12 or 13-year-old boy. Or in the way it's done to an older child. Yeah, and I mean, let me just start by saying, and this is a really important point, pleasure and pain are really, really difficult things to quantify. So I'm not going to be able to give you a really good scientific answer to that question. One of the things that was mentioned in the film is that the infant's penis, the foreskin is fused to the glands by the synechia or the balano-pupusal membrane, and that seems to make it a more difficult procedure, a more painful procedure. Also, take into consideration the fact that even today in medical settings, somewhere between 40 and 50%, some people would estimate even higher, of circumcisions that are performed are done without any kind of anesthetic. So, you know, it's a tough question to answer because, again, it's hard to quantify pain, it's hard to quantify pleasure. On the other side, we talked about that in the film too. But I would say that, you know, this sort of tearing of the synechia is probably an additional painful thing that an infant has to go through over and above what a 12 or 13-year-old boy has to go through. Yes?
Actually, I could answer that question a little better. I am a Moyle, and I do circumcisions, and I had an opportunity to do a circumcision on a newborn for a couple who were Muslim, and the father had been circumcised at puberty. And I'm sorry. I did a circumcision on an infant whose father was Muslim, and he had been circumcised at puberty. I mean, he said that they all went out together, he and all the other boys of his age, and it was a big deal not to be the one that cried, so he was very stoic about it. But he wanted his son done young. One of the big differences is whether you need to put sutures in. And so if you do it on an older boy or a man, you actually have to suture all the way around the foreskin. But you're right, the worst part of the whole circumcision, even worse than the circumcision itself or removing the foreskin, is breaking up the synechia, the attachment underneath.
Yeah, I mean, that's thank you for your perspective. I really appreciate it. Again, another part of the really difficult thing in trying to understand the difference between the pain of an infant and the pain of a young boy or an adult is, of course, the infant can't tell you what they're going through. I know there have been studies that were done in the 80s sort of checking blood cortisol levels and heart rate and stuff like that, and, you know, apparently it's sort of now universally accepted that infants actually feel a lot of pain during the procedure, and following the procedure it apparently interrupts feeding cycles and other sorts of issues. But again, it's very difficult to quantify pleasure and pain.
I just want to make one final comment, if you don't mind, which is that in terms of the healing afterwards, men that have it done as adults are really in pain for about 3 weeks is what I've been told, or what I've experienced with people. And I've follow up with all my parents, and they say that most of the babies, say about 90% of them, seem to be back to normal within, actually, most of them say that the baby doesn't seem to have noticed at all, quote unquote, and that some of them will be a little fussy for about 10 hours, 12 hours. but certainly not for weeks at a time.
Well, that's interesting because the mohellet that was in the film, actually, I didn't include this in the film, but I was there for the first diaper changing, which was a really, really difficult thing to watch. I didn't include it in the film, but she told the parents to expect that the penis wouldn't look like a normal penis for a couple of years. But, you know, that's interesting. And again, thank you for your perspective. Yes?
And scratch the walls, and you just can't take it. He said, there's no other pain, so... I already finished. You want to repeat?
Well,
yes. Okay, I knew someone who was circumcised at the age of 18 because for the medical reason, and he told me that the pain is incomparable to any other pain. That is so intensive that he said you want, forgive my English, he said you want to go on the wall and scratch the walls and you don't know what to do with it, and it lasts for a few weeks. And he said, there's nothing you can't compare, no comparison.
Thank you for your comment. Yes, sir.
One statistic that I missed had to do with the truly botched ones, not to mention the cases where babies were infected with herpes through the mitsitsa, but physical mutilation. What can you say about that? And another thing that surprised me very much, in all the movies I've seen, surgeons covered their hair. The mohellet did not. That really amazed me.
So the first part of the question was about botched circumcisions, and the second one was about why the mohellet didn't cover her hair during the procedure. Let me take the first one first. I can tell you right now the second one, I don't know the reason she didn't cover her hair, but it was a home situation. I'm sure she felt that it was safe, and she's done many before. But with regard to the botched circumcisions question, and you sort of alluded to the issue that came up in New York a couple years ago with the Mitsitsa Bepeh, it's an ongoing issue. The reason I didn't bring up these issues in the film is not because I don't think they're important. It's because I think they cloud the central ethical issue of circumcision. Because as far as I'm concerned, my understanding is that even in a situation where you had 0% chance of complication, which of course we know is not the case with circumcision, and there are many horrible complications that can occur, although it's, you know, relatively low in terms of percentage, but that still means if you're doing 1 million a year and it's a low percentage, you're still having a lot of people with botched circumcisions, and that's important to take into consideration. But getting back to the point, I think even if you could claim that the procedure had 0% complication rate, we still have a problem. And the problem is one of the things that I spent a good deal of time exploring in the film, and that's the effects on sexual experience. And of course, the sort of consent issue. Yes?
In your exploration, I won't need it, I'm comfortable with it. In your exploration, did you come across any information that suggested that the circumcision of our modern times was radically different than what was done in the past? I had, and I'm wondering if you did as well. The covenant is about blood, and there are some suggestion in some research that it was a letting of blood or a scarification, not the radical circumcision of today. That what we do today is far different than what was done in however many hundreds of years ago. And that there was a change at some point because there was restoration. Did you come across this information?
The question is whether I've come across any information that would suggest that the procedure has changed radically over time, and yes, I have. Again, this is information that's sort of based on what I would consider to be kind of shaky evidence because it's so far in the past. Anything to do with circumcision past a certain point in history is very difficult to find reliable information about. But what I understand is, and when I asked Len Glick, the anthropologist that I interviewed extensively for the film, my understanding is that the original Jewish ritual was just the milah. Right, the Jewish ritual of circumcision has three components. There's mila, which is the cutting off of the anterior foreskin. Priya, which is tearing away of the remaining mucosa, pulling back the remaining foreskin and tearing away of the mucosa. And then mitsitsa, right, the thing that has been controversial in New York, which is the suction of blood. Most Jews either don't do that at all or use a pipette nowadays, but some do it directly, oral to genital contact, which has led to the herpes cases in New York City. So yes, I understand that the original practice was just mila, that you just removed the anterior foreskin, and that was the end of the procedure, and that in Hellenic times, Jews who wanted to compete in the Olympic Games, what they would do is they would restore their foreskins. And they would do this because it was considered immodest not to be naked, of course, because that's how they performed. That's how the athletes performed in the Greek Olympics. But it was considered vulgar for the glands of the penis to be showing. So you couldn't be circumcised and be in the Olympics. So the Jews would restore. In response to this restoration, my understanding is, and again, the evidence is sort of scant, but I think this, from all of the people I spoke to, this seems to be what happened. The rabbis made the procedure more radical, added the priya, which is the pulling back and the tearing away of the mucosa, and the mitsitsa, which was actually considered medically sound at the time, if you can believe that. But they did that in order to stymie Jewish men from restoring their foreskins and make it really difficult. Yes?
I have two questions, but the first, have you or do you know if anyone else, because of the film, have had contact with the Reform female rabbi?
The first question is whether I've had any contact with Donnie Aaron. I actually work with her husband at the Hillel at the University of Chicago, and I see her from time to time, and it's a little awkward. I don't know. I don't think she's seen the film yet. I keep inviting her to come and see it, but I don't think she's seen it yet. She's one of the few remaining people who are in the film who haven't seen it yet. So I really haven't gotten a response.
You know, I used to teach parents to massage their babies, and that's, as a Jewish woman, over 25 years ago now, how I learned about circumcision, because I was at a health fair and somebody put a brochure, so I've had a long history with this. One of my frustrations, and this is as a Jewish woman, I had the honor to meet Dr. Robert Mendelsohn, who was an Orthodox Jewish pediatrician from the University of Chicago. And he was honest enough in the mid-'80s. He influenced me tremendously. He was not yet ready at that time to let go of the practice for religious reasons, but he was very clear, as some of the people in your film, that there was harm, that there could be excess bleeding, even death. What I find frustrating, and I'm not sure we just keep going forward and educating who is ready to listen, is a situation where Leonard Glick mentions that there are a few pro-circ doctors who have been in the medical literature, and how that one doctor, Moyalette, uses the pro-circ information to justify their position instead of taking an objective medical position with all the information that's out there today, and then the religious. And some people in your film did that, but she didn't.
No, the Mohela didn't do that. I think Donnie Aaron.
The other woman.
Donnie Aaron did that. Donnie Aaron actually built her entire case for circumcision on the health issue, which it's frustrating. I mean, part of the work that I tried to do with the film is, to slice through those myths. Why? Because I want to have a discussion on a level that sort of, is above that. I think that there are, I think that's sort of, what Kierkegaard would call a lower immediacy kind of level at which to have this discussion, and I'm interested in sort of getting a little higher than that. And I really, I think that there are two sort of, shall we say, internally consistent positions that would favor circumcision. One of them I presented in my film through Heshi Warsh, Rabbi Warsh, the Orthodox rabbi that I interviewed, in which he said basically being Jewish means being obedient. And I reject that because I feel that that makes religion into, the kind of poison that Christopher Hitchens talks about, or, name your sort of atheist du jour. And that bothers me. This notion that the human enterprise has absolutely nothing to do with religious traditions, to me, makes religion very upsetting. And the second position that I think is internally consistent, but I didn't present in the film because, frankly, I find it to be beneath contempt, is the cultural relativist position. It's the position that says that, it is consistent. I have to give them that, right? They say that we should stop trying to prevent people from circumcising girls, and we should stop trying to prevent people from circumcising boys, right? So in that sense, it's consistent. But I find cultural relativism in this sort of, postmodern idea of, well, if it's a cultural practice, then, we basically can't criticize it. It needs to be accepted as a cultural practice. I find that to be really horrible.
I just want to add one other thing, because I do groups, and I hear a lot of stories that most other people won't hear. One man did tell me that he was circumcised an adult, and he said it was like 2 months that he felt he had a hot brick in between his pants. That was his story.
Thank you.
I'd like to just close by saying that, first of all, the DVD is available on sale outside. When I selected this film, when I saw it for the first time, one of the things that I'll really commend about this film is, although you make your opinion really clear in this, you let everybody really express themselves in this film, even if it's contrary to your opinion, which I say goes way beyond just being a Jewish Michael Moore, but really taking it to the level that that documentary film should go to. So thank you very much, Eliyahu.
Thank you so much. Thank you.
Thank you all for coming. I look forward to seeing you here again soon. Next week, again, Shira Geffen and Edgar Carrot. Thank you.
Thanks so much.
Thank you.